African Americans being hit disproportionately hard by the virus. In Chicago, they comprise only 30% of the population, but account for a staggering 72% of deaths.
Those numbers take your breath away. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay. Talking about the income, healthcare, life expectancy disparities that are really plaguing Black and brown communities all over Chicago. So we know that, for example, the rate of diabetes, heart disease, upper respiratory illnesses, all of those things are exponentially magnified throughout Black and brown communities. And this virus attacks those underlying conditions with a vengeance.
The fact is that during a crisis, it magnifies the disparities that existed before the crisis. And in a crisis, people who are doing bad do even worse. Those who had pre-existing health conditions based on racial disparities, based on socioeconomic disparities, are doing even worse in the midst of this pandemic. And so it requires us to address it in a way that also recognizes the historical nature of it.
We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever. You look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care.
On the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
Let's learn how and why this virus kills, especially why we have higher fatality rates among African Americans and Latinos, and what we do about it. Let's understand it, but let's also address it. We're going to be doing more testing in African American and Latino communities. With more data, we're going to open new testing sites, primarily in African American and Latino communities.
Currently, 30% of those within that data set of 6,306, 30% are identified as Hispanic, Latino, Latina, 30%. Number positives, 6% within the Black community, and 14% within the Asian community.
I'm Barry Gordon.
And I'm Andre Coleman.
This is NewsRap, live at 5.
Hit it.
Hey, Dre. How's it
Hey,
doing?
man, back again.
Back again.
I see you changed location.
Yes. This time I'm going to do a virtual tour of the house, I think, So next week it'll be the kitchen, We'll just keep doing it till I get to the bathroom, and I'm not going to do the bathroom. I'll skip the bathroom. But
I moved my office this time, got it a little better. I mean, earlier you saw just how clean my office isn't.
When we were rehearsing, yeah. But you were saying that you got a 3D printer. That's cool.
Yeah, I printed some masks for the family. But right now, man, it's really hard to get the filament to print anything because a lot of people are printing them for hospitals.
Yeah.
And for first responders. So I looked last night, I think there's a hold until May or June to get any filament.
Is it hard to learn how to work one of those things?
No. The hardest thing is pretty much every time before you print, you need to make sure that the bed is leveled. And that's really just 4 screws. Easy. Other than that, it's all computer controlled.
Yeah. No, I wanted to ask you because, say again?
I said, I'll make you something so you can check it out. It's really fascinating.
Neat. I'd love to. So even before there was a major discussion, which there has been for the last few days, about the racial disparities between white people and everyone else in terms of getting the coronavirus and also dying from the coronavirus. And so I guess you had already written about this, but you wrote about it and I really recommend, if you haven't read the article, you should read the article. So go to Pasadena now and try to dig into the archive somehow and find that article. But you had a somewhat different twist, because you were hearing a lot of misinformation that was going into the black community, that black people might be immune to the virus. Is that what was going on?
Yeah, a whole lot of people posting when this began, and even now, not as many, but there's still some people who think black people can't catch this, which is irresponsible, unsafe, and just completely wrong and false.
Well, it's actually the reverse of what's happening, is that it's taking a greater toll on African Americans than it is on white people.
Yeah, well, look, when you think about obesity, when you think about heart disease, when you think about diabetes, these are all issues that African Americans are more likely to deal with than white people. It's a reality. And that being said, so instead of this idea that we can't catch it, it could decimate our communities.
Yeah, it really could. And why? Has anyone traced why there is this higher, what they call comorbidity in the African American community? Is it lack of health care? Is it lifestyle? What is it?
Well, Judy Chu yesterday, and they call it the Tri-Caucus, they called for the CDC to start recording the demographics of who exactly is being tested. So they will see if there's equality in testing or if racial bias is playing a part in that. Now, while I did list, and I listed in the article, those underlying conditions that could impact African Americans and anybody, quite honestly. Yeah. The other thing you have to question is the healthcare system. I mean, they're putting up a lot of free clinics, they're putting up a lot of free testing spots. Where are they putting them?
Right.
Are they putting them in communities with a majority African American population? Are they putting them in communities where African Americans can have access to them?
Exactly.
So it's
and Governor Cuomo said specifically that he was going to do that. Once he discovered that the problem existed, he said that the important thing now is to put testing where the problem is, and to try to find out what's going on.
And, we still have to consider African Americans are more likely to live in poverty, which impacts your health.
That's right.
Which could also impact your recovery.
Right.
Until these things are addressed, I'm afraid that it's going to probably keep going this way.
Yeah. And of course, in blue states, they have much less access to health care because the Medicaid expansion hasn't happened. So unless they're very, very, very poor and are able to get Medicaid, they might well fall through the cracks and not have any access to health care. And that's a terrible situation.
Well, and I think that this is what this pandemic exposes about the country, is that we still have issues that need to be dealt with as far as from a racial perspective.
Yep.
Possibly even racism in the healthcare system, poverty, and let's face it, how long has the discussion on healthcare been going on? At least for 8 years, at least the 8 years of the Obama administration and the 3 years of whatever Trump calls this thing he's got going on.
That's right.
And still, everybody's not covered. Still, there are probably people, as you just said, falling through the cracks. And as those people fall through the cracks, we see people die.
I know. I mean, I'm seeing this unbelievable picture right now on my television. It's in front of me. And I'm seeing this unbelievable picture from San Antonio, of cars and cars and cars lined up at food banks. I mean, it just incredible, hundreds and hundreds of cars in one shot that they got, I guess an aerial shot that they got. And it's horrifying. I do want to do one thing before we keep going.
Jared?
We did have a comment. So before we keep going, I want to see that if I can again. Is that possible? I don't know. Yeah. Maybe not. But it was from our friend from New Jersey, Sarah Greco, who said, Sarah. Hi, guys. Thanks for the shout out last week. I think it said went away, but it said my family's staying healthy. I'm glad to hear that. Yeah. And we were worried about you, Sarah, because we know that New Jersey is a hot spot. So stay well, stay home, and have a happy Easter.
And I think you hit the keys right there, Barry. I mean, I think as this thing continues, I saw President Idiot on TV a little while ago, and he was again talking about it would be his decision to restart everything, or he could make that decision if he wants to. But look, the key here is
he even said he could override the governors.
Right.
If he wanted to, he could override the governors. I don't know where he gets that one constitutionally, but he said it. So.
In the same fantasy land where he says he's a great president, undoubtedly. But I think the key is that the models are now saying that if the order's in too soon, the cases will spike.
That's right.
And if the cases spike, then the fatalities will come along with them.
Yes.
So, I just hope everybody, look, all of us want to go back out, none of us like it, but I just really hope that all of us see that this is to our advantage right now. Simple as that.
Well, all we can do right now is you're right. I mean, we have to hold the course. We really can't worry about, the orange-haired idiot right now. We can't deal with that because it's just he's made an incredible number of mistakes, but he does have some good people around him.
I agree.
And I'm hopeful that those good people will prevail. And if those good people don't, then the governors, who are doing a pretty darn good job right now, for the most part, I could name a couple that aren't, but for the most part, and certainly I'm prejudiced, so the ones in blue states are doing a really good job for the most part. Like Cuomo and like Newsom's doing okay, and Inslee and Brown, and so they're doing fine. And hopefully they're the ones that are going to get us through this. But I got to tell you, I've been watching TV, and this is a little bit of a departure for us because I usually like to rant and rave. But the scenes that I've been seeing, the humanity, it's been for me, and I'm not a religious person anymore, but it's really been a spiritual experience to watch these healthcare workers, to watch them talk to us. They're doing things on Instagram, they're doing things on the shows, on the pundit shows, and they're just showing such a level of humanity and caring and empathy. And I just wish that was coming from the White House. It isn't, but it sure is coming from everyone else.
Did you see the tribute yesterday, the Pasadena Police Department, Pasadena Fire Department, to the healthcare workers at Huntington Hospital?
I just saw yes, I saw a little bit of it. It was marvelous.
Yeah, they showed up, activated the sirens, activated the lights. It's not much, but I think at this point the doctors and nurses need to know that they're appreciated. Mm-hmm. They're putting their lives on the line every day at work. Some of them don't have the equipment they need either. So it's good to hear that Huntington yesterday they got thousands of masks donated. We're going to have that here in a second in our local brief, but it's good to hear that people care enough to do these things.
That's right. Shall we look at our local brief?
Yeah, let's check it out.
Do it.
This is your local news brief for Friday, March 10th, 2020. There are 5 deaths attributed to COVID-19 in the city of Pasadena. The patients ranged from 45 to 93 and were all linked to long-term health facilities as either employees or residents. Pasadena Now reports 94 confirmed cases in Pasadena. COVID-19 testing will continue throughout the month of April at the Rose Bowl. Testing will be conducted on weekdays and only for patients who meet any of the following criteria: patients over 65, patients with underlying health conditions, patients with more than 7 days left of mandatory quarantine. More information on registering for a test can be found at covid19.lacounty.gov. During the Pasadena City Council meeting on Monday, April 6th, the Council agreed to a utility underground surtax reimbursement covering from April 2018 to March 2020. Collection for the tax has been suspended for the next 4 months, lowering customers' electric bills by 4%. The decision on reimbursement and the tax suspension comes in order to ease financial burden during the pandemic. The Pasadena City Council also approved the use of the Convention Center as an emergency facility to fight COVID-19. The emergency facility would be used only if the Huntington Memorial Hospital reached capacity. Additionally, the facility would be used to treat patients with mild symptoms, as well as serve as comfort care for those not expected to survive the virus. Nearby resident Vincent DeRosa expressed his concern to the council about the lack of an approved public safety plan to reduce exposure to healthy residents in the area. Pasadena Now reports that Mayor Terry Tornick acknowledged the concerns and said the issues will be addressed. The budget allocated by the city of $700,000 is anticipated to cover the facility for at least 3 months. Although the facility falls under FEMA guidelines, there is no guarantee that the city would be reimbursed. Huntington Hospital has not reached capacity yet and recently received 600,000 Level 3 surgical masks and 200 isolation gowns from Guardians of the Angels charity organization. California's Judicial Council is moving towards setting $0 bail for most misdemeanors and lower-level felonies. The amendment is in the hopes that fewer inmates will help curb the spread of COVID-19 in jail. The amendment applies only to new cases and does not apply to those who have already had their bail set. As of now, risk assessments are not being made for new cases. The council also adopted to prioritize juvenile cases, as well as extend the statute of limitations for civil proceedings. Local courts will be allowed to hold hearings remotely.
Hey guys.
Barry had some technical difficulties for just a second. It looks like he's just about back with us.
I'm just about back. I'm back.
All right, to update those numbers.
All right.
Because the numbers are not correct.
Okay.
I got some updated numbers right before we came on the air. So the Pasadena number is now confirmed cases of 117 and 7 deaths. That's up from 107 yesterday and 5 deaths.
So has there been a calculation as to when we're going to hit our peak?
No calculation yet. A lot of our infections, a lot of our deaths are coming out of our senior assisted facilities, from what I understand.
Yeah.
I don't know when we're going to hit our peak. I would expect, because our rate was just about the same as LA County's, our mortality rate, earlier this week. So we might go when the county and the state goes also. But I saw a comment from Eric Bailey a little while ago. Can we put that back up?
Yeah.
In Cook County
more. Yeah, go ahead. You read it.
In Cook County, more African Americans are dying of the virus than whites, and I didn't see the bottom part of it. But also in Milwaukee.
We can't leave it on. Can we leave it on? I don't know.
Yeah. Dying of coronavirus than whites. Part of it looks like it's cut off on my screen. Can you see the rest of it, Barry?
Yeah, it's funny that blacks only make up 23% of the population.
Well, you know what? The death rate among African Americans is higher in Milwaukee.
Yeah.
Imagine what the African American population is there.
Yeah.
New Orleans, they're not yet keeping records by that demographic, but that's going to start soon. We'll know what's going on there. But this just seems to be a trend across the country.
It does.
It does. Which is sad to say.
I know, and I think you're so right that it's a predisposition that's caused by so many different factors, and we've got to get to those factors. And but one of the things is this whole crisis is telling us a lot about our healthcare system.
I agree 100%.
It's telling us that we've got great healthcare in terms of the people, in terms of the technology. Yes, we've got great healthcare that way. We don't have great healthcare in terms of access. I mean, what if the Congress had not decided to pay for the testing? What if Cigna and Blue Cross said, no, we're not going to waive co-pays.
Yeah.
Everyone's screwed if that happens. And so right now, that's very nice. But I don't think that a system of healthcare should be dependent on the philanthropy of healthcare insurance, health insurance companies.
Completely agree.
Or pharmacies. Or pharmaceutical companies. I mean, and we are.
It doesn't give Huntington the mask.
Yeah.
So
it's not a good situation, and it's definitely something that we're going to have to deal with over time.
Not only that, I mean, the response to this federal government the response of the president was pathetic. It's going to go away in May. When we had 15 cases, next week you'll have 0 cases. All of these things were pie in the sky statements that everybody knew it wasn't going to happen that way. And even now,
and he can blame the WHO all he wants. Yeah. But the fact is, yes, were they slow? They were slow. Were they as slow as Trump? No.
Yeah.
So I mean, he knew what was going on, and he knew enough to close down the border. Now, why at that moment, if I'm going to take an action like that, I'm going to say I'm going to close down the border and I'm going to start a mobilization because it's coming over.
Right.
No matter
and it was
what.
Obviously it was coming over. Even now he's jumping up and down and he says he's a cheerleader about the fact that, it may be limited. I mean, the new model says 60,000 deaths, but that 60,000, that model is based on everybody staying in their homes, the order going, through May. And there are a lot of things that could happen that could change that. I mean, we need to still be in a strong public safety stage and a strong education phase about this virus and about what happens if people go outside.
We do. And I think also we've got to talk a little bit about the fact that this is a time where normally people of, many faiths would be celebrating in large groups. Passover, certainly, although frankly, that gets exaggerated. There aren't synagogue services for Passover. Passover is a family event.
Right. Celebration event.
Yeah. Basically, they have seders for people that, are alone and don't have, families to have seders with. But for the most part, it's not that. But Easter certainly is. And the way the Pope has responded, by live streaming an Easter service alone, I mean, it's just a phenomenal response. And what disappointed me was hearing that a lot of the people that refused to follow the stay-at-home guidelines in New York City were Orthodox Jews. It was Orthodox Jews, and that really, really, really bothered me. And yes, there were Orthodox rabbis that were telling people to stay home, but there were other Orthodox rabbis, you know, and now if you're a religious person, and I don't know how to say this gently, don't test God right now. You know, don't assume that your religion is going to get you through.
Yeah.
It probably is not. And God, if you believe in God, then believe that God gave you the wisdom and good sense and judgment that you need to take care of yourself and to take care of your family, and frankly, to take care of the people in this country, because once you go out, you hurt other people, or you can't hurt other people. So enjoy Easter, enjoy Passover, what's left of it, eat your matzah, you know, but please, please stay home. And, you know, let's get through this and find the different kind of spirituality within yourself and within your family. And we can all do that.
Yeah.
And now,
well, your religion shouldn't kill you. That's what it comes down to.
Yeah.
You know, you can believe in something, have faith in that, but you don't need to go outside right now to have that.
That's right. That's right. We had a comment from Eric, I think, about downplaying. Yes, he did. He has downplayed it.
That's
but
right.
There was something about reelected, and I didn't see in order to be reelected. Well, you know, I don't think that's the way to get reelected, frankly, because now that we have 18,000 deaths in this country, which is what, 6 times more than World Trade Center, than 9/11, and how much more than Katrina, right? So we haven't seen anything like this. So if anyone still believes that downplaying it was the right thing to do, go ahead, vote for Trump. But, you know, that's maybe 30% of the country.
Well, now
that isn't enough.
I know we got to wrap up, but now most people don't support the federal government's responses. They think it was a poor response. So it's not working either.
Right. Do you want to stay on and do some Facebook?
What do you think? You want to do it?
Do we want to talk about Sanders?
Yeah, let's do it.
All right. We're going to stay on. We're going to do Facebook. We're going to go off the Arroyo channel for now, but we will be with you next week. I'm Barry Gordon.
And I'm Andre Coleman.
Happy Passover. Happy Ramadan coming up. It's a time to celebrate being alive. I'm Barry Gordon.
I'm Andre Coleman.
NewsRap, live at 5. Moving on to Studio B, which is going to look a lot like our house.
Yeah, you got a Studio B at your house.